in-service video for the Blanketrol 3. Today we're going to review hyper and hypothermia. To turn the machine on, all you're going to do is flip the switch in front of the Blanketrol 3, and the B3 will actually go through a series of self-checks. You'll hear some beeps and see a little flashing. Once the self-checks are done, it will tell you to check set point. All you're going to do to stop the flashing of the check set point is hit the temp set button and get ready to precondition the water. The domestic Blanketrol 3 can be used in degrees C or degrees F. You can toggle back and forth just by hitting the CF button. To precondition the water, you'll either set the water for 4 degrees C or whatever your hospital prescribes. To get the water to that temperature, you're going to use the up and down arrows until you get to the prescribed temperature or 4 degrees Celsius. When you reach 4 degrees Celsius, you're just going to hit the manual control button and turn the machine on. That will actually circulate the water inside the B3 and get the water ready for your patient. While you're waiting for the water to get to the proper temperature, you want to make sure that you have the proper supplies ready to take care of your patient. For that, you want to make sure that you have a Kool-Kit ready, the temperature cable and probe, and 3 hoses to connect to the Kool-Kit. In this segment, we're going to review the application of the Kool-Kit. Please understand that this is just for demonstration purposes only. The patient's rectal probe has not been placed. We are using a simulator for this demonstration and for this video. To apply the patient vest, we're going to use my 2 assistants so I can walk you through it. Dan and Allison are first going to roll the patient onto his side. If you were doing this in the emergency department, you'd roll the dirty sheets up underneath the patient, roll the patient vest behind the patient's back, with the opening ending up around the thoracic spine between T2 and T4. Roll the patient back on their other side and pull the patient vest through and any other dirty sheets that might be there. We're going to put the chest flaps over the patient and Velcro them down. We want to make sure while we're applying the patient vest that it completely covers the upper vasculature of the chest to make sure that we get in nice and snug into the clavicles and wrap nice and snug around the flanks. Once the patient vest has been applied, we're going to attach the hose and begin cooling. This will allow the vest to fill up and give a good fit to the patient vest. This will also give best body surface area contact. You want to make sure when we do all this that we leave all lead wires, leads, and defibrillator pads in place in case the patient needs them down the road. I am going to pre-fill the head wrap. To pre-fill the head wrap, all I'm going to do is attach it to the hose, another hose of the Blanketrol 3, and pre-fill. What this will do is give the best fit possible to the patient with the head wrap. I'm going to ask one of my assistants to help me and lift my patient's head to slide the head wrap underneath. Slide the head wrap down to approximately T4 and wrap the head wrap around the forehead. If you have a monitoring device on the forehead, leave it in place. Gently wrap around and Velcro down. Wrap around the neck, get a nice snug fit. It doesn't need to be tight. Make sure the ear is clear. If your patient has an intracranial pressure monitor or they have long hair, you can thread it out the top of the head wrap. If not, close the flaps for a nice snug fit. Once the head wrap is in place, we're going to apply the lower body blanket. To apply the lower body blanket, you're just going to place it between the hips and the knees with the hose coming out the side and tuck it in a little bit around the legs. You don't need to go crazy tucking it in, just give it a good custom fit. Once the blanket starts to fill up, cooling has fully been initiated, and your patient's temperature should start to decrease. In some patients, a chest tube is required or the insertion of a subclavian line. For those patients, you want to maintain your cooling. To maintain cooling, all you need to do is undo the Velcro from the side by opening up the patient vest on the side they want to put the chest tube in on, or the line. Wrap the patient vest chest flap around the patient's arm. Open the vest up. You can see the patient's chest and subclavian without any obstruction and still maintain the same body surface area. In the unusual event that a patient could not be fully covered by the patient vest, take the other side and wrap it around the patient's arm. Again, maintaining a larger body surface area. While you're doing that, you're going to have someone else take the lower body blanket off, open up a full body blanket, and apply it to the patient. What this will do is give us a little bit better coverage of a patient who doesn't completely close in the patient vest. Once we attach the blanket to the Blanketrol 3, the blanket will slowly fill up and give us a better fit. There should be no patient gown or any other objects. The blanket and the Kool-Kit should be placed directly on the patient's skin. Today we're going to review the manual mode, the automatic mode, the 10-degree gradient, the gradient variable mode, the smart mode, and the monitor-only mode of the Blanketrol 3. To use the manual control setting, all you are doing is controlling the temperature of the water. You are not controlling anything else. To start it, all you need to do is hit the temp set button in the center of the console. Using the up and down arrows, you will set the temperature of the water. When you have reached your desired temperature, hit the manual control button and the water will circulate. To use the Blanketrol 3 in the automatic mode, you must have some sort of temperature sensing device in your patient. Then all you need to do is hit the temp set button in the center of the console. Using the up and down arrows, set the patient's desired temperature. Then press the automatic control button. This will circulate the water around the patient at a maximum of 42 degrees Celsius and a minimum of 4 degrees Celsius. To use the gradient 10-degree mode on the Blanketrol 3, all you need to do is make sure that your patient has a temperature sensing device in. Then press the temp set button in the center of the console. Using the up and down arrows, enter the desired patient temperature. When the desired patient temperature is entered, press the 10-degree gradient button. The maximum water temperature change will be 10 degrees higher or 10 degrees lower than your patient's body temperature. The temperature in the machine will change based on your patient's needs. To use the Blanketrol 3 in the gradient variable mode, all you need to do is make sure that you have a temperature sensing probe in your patient and it's attached to the Blanketrol 3. Then press the temperature set button in the center of the console. Using the up and down arrows, press the desired goal temperature for your patient. When the desired temperature is entered, press the gradient variable button. In the center console, it will show variable gradient offset, 0 degrees C. This is where you will enter the gradient variable offset that your hospital has desired in its protocol. Using the up and down arrows, enter the desired gradient variable offset for your institution. Then, to get the water to circulate, press the gradient variable button. The water temperature will be based on your patient's core temperature, plus or minus the gradient variable based on your patient's needs. The smart mode can be used in the gradient variable or the 10-degree gradient mode. It evaluates your patient's temperature every 30 minutes. If your patient is not at target temperature, it adds 5 degrees more therapy to help your patient reach target temperature. The monitor-only mode in the Blanketrol 3 can be used to just monitor your patient's temperature and evaluate if there is a need for therapy.